Hello, today I will be talking about Medicaid and CHIP reform, improving children's access to equitable healthcare in the United States. So, in summary, both Medicaid and CHIP, or the Children's Health Insurance Program, are two different federally and state funded health insurance programs that serve about 50% of all children in the United States, including racial and ethnic minorities and medically complex children. These programs provide health care to millions of children who would otherwise lack insurance. So the goal of these programs are to increase access to high-quality, comprehensive, family-centered, and equitable care for all children and their families. Medicaid provides coverage for children from low-income families receiving government assistance, children with disabilities, and children in foster care. And this was expanded by the Patient Protection and Affordable Care Act to include all children and households with income less than 138% of the federal poverty level. CHIP, on the other hand, covers children with household incomes that are too high for their state's Medicaid income eligibility threshold, but too low to afford private insurance. So Medicaid's strengths include no waiting periods or copays, and there's also something called the Early and Periodic Screening, Diagnosis, and Treatment, or EPSDT, benefit, which kind of provides a standard that all states have to adhere to provide a broad array of services. So many children insured by Medicaid thus have the opportunity to have both good short and long-term health outcomes. But of course, these programs also have limitations. And so one of the limitations comes from the fact that both of these programs are both joint federal and state funded. And so because of that, there is some state-by-state variations in eligibility, enrollment, covered benefits, scope of coverage, payment, and quality standards. So originally, this kind of flexibility was given to the states to kind of give the states autonomy and flexibility in how they wanted to innovate their programs, but unfortunately leads to a lot of variability where certain states have lower quality services or don't cover as much, and so that leads to inequity in healthcare across the United States. So these variations also affect families who need to navigate different programs, including re-enrollment processes, and pediatricians who may see patients across state lines are also affected. So the first proposed policy change would target the goal which is to increase coverage for all children aged 0 to 26 years in the United States. This is so that every child in the United States, should have access to health insurance coverage. And I think this one's pretty straightforward. So the idea is that Medicaid and CHIP should be combined into a single program, and all children born in the United States can be automatically enrolled at birth with the option to opt out if they have other sources of insurance. So the second proposed policy change is to eliminate state-by-state variability. So the goal here is that children aged 0 to 26 years insured by Medicaid/CHIP should have meaningful access to a consistent, high-quality set of services and supports that meets their health needs, including mental, dental, and preventive health services, regardless of their state of residence or their socioeconomic status. And so, as I mentioned previously, because Medicaid is funded jointly by both the federal and state level, certain states that have a lower amount of revenue thus have a lower amount of funding. And so this can perpetuate low quality of care for these states that have a large proportion of minority populations who typically have lower income, thus resulting in lower state revenue and then less funding for these programs. So a solution would be to increase the federal share of funding for Medicaid/CHIP, especially for all direct patient care, and establish and enforce national standards to care to eliminate state variations that lead to unequal access to care. And so this means providing financing at least consistent with the higher of commercial or Medicare rates. And so when I talk about the national standard, what I mean is the EPSDT, or the Early and Periodic Screening, Diagnosis, and Treatment. So strengthening that kind of standard and enforcing it as a national standard of care and quality. And then another aspect of this policy is about kind of preventing gaps in coverage when children move across state lines. So in this way, the previous state should provide seamless coverage until the new state is notified about the termination, and the new state should then grant presumptive eligibility, and then services accessed only by crossing state lines, such as subspecialist care, should be covered without any interruptions. This should also apply across counties for children enrolled in managed care plans. And so this can definitely help improve eliminating gaps in coverage when children move or when pediatricians have to provide care to children across state lines. As far as the three branches of government and their respective roles in these policy changes, the legislative branch is in charge of creating laws, so they will probably draft these bills for these policy changes. The executive branch is in charge of enforcing laws, and the president can also sign bills into laws. And the judicial branch includes the court system, and their job is to review and interpret laws, make sure they're constitutional, make sure they're equitable and truly benefit, Americans, and so they can help with the review process of this law. And so I just wanted to include this quote from the AAP's recent policy statement from October 20th, 2023, about why policies like these are so important. Greater investment and key reforms in Medicaid and CHIP represent strategic initiatives critical to the future of our nation. Improvement in the physical and mental health of children will achieve an immense long-term return on investment over the lifespan, including lower rates of disease, greater productivity from a healthier workforce, and reduced adult healthcare costs. Making investments in Medicaid and CHIP supports a necessary shift from a highly variable state-by-state system that generates and exacerbates health disparities to a more uniform program that fosters healthy young people and a productive adult population, allowing individuals to attain well-being, counteracts the effects of poverty, and reduces the likelihood of future incarceration with a multi-generational impact. And here are my references. More information can be found on the AAP website, the American Academy of Pediatrics, and their recent policy statements.